You might have a co-worker who is transitioning and they want to be addressed in a certain way. It is not your job to go question them as to why do you have a name called Paul when you are a female. No, leave it alone. Be sensitive to every gender. Hi, my fellow international nurses, foreign trained nurses, overseas nurses. Let's talk about transitioning into the registered nurse role in a fast-paced country, in a Western world, in a very developed country. This video can be related to any other country, not necessarily USA, even though I'll be referring much to USA because I live and work in USA as an immigrant nurse or as an international nurse who also schooled and trained outside, that is Ghana, and transferred over my education and my license to USA to work here. My name is Priscilla Kuma. I'm a registered nurse. I am the lead consultant for USRN Pathway Consult. As you can see right here, we help nurses who intend to work in USA. So far as you schooled outside the USA and you have the registered nurse certificate and license to prove it, and you have the interest to work in USA, we will help you out. www.usrnpathwayconsult.com. Check out our website, register on there, and let's take you through the process. You have the interest in writing NCLEX, you want to relocate, you are confused. Should I do it? Is it worth it? I will tell you that it is worth it, and you need a professional to guide and coach you so that your process does not delay or you do not get your paperwork messed up. Let's go to the topic of the day. Transitioning as an overseas nurse to an RN in a different country, UK, Ireland, USA, wherever, fast-paced, developed country. I know it's very normal to be anxious. We all have the anxiety. We all went through it. You don't know how it's going to be out there. Journey of the unknown, life of the unknown. What is my future going to be like? What is the future of my family going to be like? What is the future of my career going to be like? Okay. Let me tell you that the anxiety is normal. We all went through it. We are still going through it. So it's normal to be anxious and nervous and not knowing whether you are making a mistake or whether you're making the right decision. Anxiety is normal. But there are so many ways that you can curtail that and become successful. You have written NCLEX, you are about to write NCLEX, or you have not even started anything yet. You are waiting for a push or you are waiting for someone to motivate you. I'm sure I've been doing that on this channel. So subscribe if you haven't subscribed. So nursing in USA, I'm sure you've heard, is very different, just like nursing everywhere else. If a nurse is coming from USA to go back to Ghana or Nigeria or anywhere else to work, will be different because it's not your country, you did not train there. So the difference is there. And it's more different for us who schooled in Africa, who want to work in those worlds because, number one, technology is involved in the nursing. Computer is involved. There are apps you need to use. There are gadgets that are computerized that you need to use. So all these ones should be trained. Do not be afraid. All that matters is that nursing is the same everywhere. You know how to care for people. If you have that instinct, that passion to care for people, you will adapt to your environment. So either you've been a nurse for some time, you've taken a break, and you want to come back and you're anxious, this transition video will also help you. And if you are moving from a different country to another country, this video would also help you. Just make sure that you watch to the end. Hit the thanks sign to say thank you. If any of my videos have been beneficial to you or your loved ones, it ranges between $1.99 to $4.99 to say thank you with the love sign at the bottom of this video. And the transcript is in everything I'm saying. So let's zoom in. First of all, deciding to go to a different country, you need to read about the country. You need to research about the country. You need to watch videos or movies around that country, their weather, the culture of the people. You need to be very, very sensitive to the culture of the people. There are certain things that are acceptable in some cultures that are not acceptable in other cultures. Back home, we are used to holding hands, touching people, shaking hands, hugging people, sitting on them, talking and slapping them. No, 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 you cannot do that out here. There is no physical contact. You cannot be talking to your coworker and put your hand on their shoulder, showing them something. No, there should be personal space, we call it. So learn to be sensitive to the culture. The food you eat back home, the food they give your patients in the wards or the units, it's not the same thing over here. Somebody has diabetes, you go to their room and you see ice cream on their tray, you see cake on their tray. What is inside that, the content or the calories and the carbohydrate level is what matters. You cannot say, don't eat ice cream because you have diabetes. It is the culture here. The dietitians are on top of it. They know what they are doing. So learning the food is also something for you personally as well. I'm laughing because I remember going to the canteen and didn't know what to order because everything there is foreign to me. This is an employee canteen in the workplace, and I'm standing there. I can't speak or say what I want, so I'm just pointing. I want that one. I want this one. I want that one. So read about the food, watch movies, pay attention to the food around you, and begin to adapt your taste bud to some of these things. So anxiety is normal. Do a lot of reading and research about the culture of the people and be ready to embark on this journey. It is always best to relocate first. If you're a registered nurse, you got a job in Ireland, UK, US, wherever, and you have a family, I always advise that the nurse relocates first. At least get there, find accommodation, settle in before you bring your spouse and children. That is ideal. Most people have done it that way. You might end up getting an accommodation that does not work for you. And if you already came with everybody, that means you have to now move and relocate and go find somewhere else. And in finding an accommodation, when you have a job offer, you want to make sure your accommodation is not too far from the job as well. Because the first few days, obviously, you will not be driving. And you will need to take public transport. If you happen to be in a neighborhood where the transportation is not great, or the bus times are different, or the train and tram, the subways, their times are different from when you are going to work, you will be found wanting. That is why you don't have to live so far away from your workplace. Yes. And also, with the transportation, you would have to need a driver's license to be able to drive. It will take you some days, weeks, or months to get the driver's license. So in the meantime, you'll be doing public transportation, you'll be doing Uber, taxi, cab, subway, trams, and all that. So factor that in. If you don't know how to drive, it is a life skills, it's a necessity out there. People need to know how to drive. Even though some places, owning a car actually hurts you more because it's expensive. You have to pay for parking, you have to park at the roadside. If you don't find parking, you have to park miles away from your house and also walk home, even though you are literally parked in your neighborhood. So some places, the public transportation is highly recommended. It depends on the city you are going. If you're going to a very big city, that means the transportation system is great. If you are going to the suburbs, outskirts, that means you would have to have a car to be able to move, because not every neighborhood has a bus passing through or plying your streets. You would have to walk all the way to the bus stop. And mind you, the weather. Bear in mind the weather as well. Are you going to be walking in a snowstorm? If it's hailing, rain is falling, there's a storm, will you be able to walk all the way to the bus stop? Yes. So factor in where you are going to live and the transportation. Work on getting something that will make your commute easier. When it comes to financial preparation, you should always save up some money whilst you're intending to relocate. Save up some money. Have some of that currency before you touch down in the country you're going to. If it's euros, if it's pounds, if it's USD, American dollar, Canadian dollar, have some money with you, because you might arrive at the airport and there'll be nobody to pick you up and you have to pick an Uber home or pick a taxi home. You might have to buy a SIM card, you might have to buy a snack to eat. So always have some money with you, at least maybe $1,000 or £1,000. Always have some money with you, something in your pocket for emergency sake. That would also help your transition easier. You buy a cell phone and tell them, oh, I have arrived here and this, you can afford data and all that. So have that money to help you ease your transition. So let's now zoom in into the nursing career itself. Ideally, you'd always obviously have the license to be able to practice in that country. There are some courses on the side that you will take. Some of them are BLS, ACLS, or RQI. Those are just basic life support trainings that you would need to be certified to work in certain fields. Some states require everybody to take it. For New York like this, you need to have that BLS. And now we've changed it to RQY for my workplace. So it depends on where you are. They'll get you all set up for those certifications to be able to practice. So preceptorship, I made a detailed video about preceptorship. It's basically training. You'll be trained on the job. It can be between 3 months to 5 months, depending on the facility you are working in. People have cut the preceptorship short because of COVID, but you need to do the full training, especially if you did not school here, if you did not do any clinicals here as a nursing student, and if you've been practicing nursing for long outside the USA, and if you have been out of the profession and you're now coming back, or you are a specialty person, you're a midwife and you've gotten an RN job, you need to let them take you to the thorough orientation. Mine lasted for 12 weeks, that is 3 months. And mind you, if you are not comfortable to get off orientation, you can always request more time. There is preceptorship and there's residency program. In the coming days, I'll tell you about nursing residency. It is a whole 1-year program I did. It's actually meant for new grads, but I always equate overseas nurses to new grads. No matter the years of experience you have, the system is different. Nursing is entirely different. The gadgets are different. The documentation systems, the softwares are all different. So you need to go to that training. Forget what anybody will say that you are not a new grad, she's had all these years experience. Sit in that class because you know the goal and what you want to do. So when it comes to preceptorship, I pray that you get a good preceptor. If not, it will make your transition harder. It will make your transition very hard. So normally they might give you 1 person or 2 people to rotate with. They might let you try out all the shifts. There are different shifts. That is one thing about USA. The shifts are not rigid at all. Can you believe there's a shift that starts from 3 p.m. to 3 a.m. the next day? Shout out to my friend Carissa. She gets off work at 3 a.m. every day and goes home at 3 a.m. Yes. There's 11 a.m. to 11 p.m. There is 7 a.m. to 3 p.m. There is 7 a.m. to 7 p.m., which most of you know about, the 12-hour shift. And there is the 7 p.m. to the next day, 7 a.m. in the morning. There's 7 to 11. You can just go and do 4 hours. So you can always find a shift that will suit you. During your orientation or preceptorship, you're going to be trained and tried on all the shifts. And then it is up to you to decide what shift you want to work. One thing about the shift system is that nobody imposes any shift on you at all. You make your own timetable. You make your own shift based on the needs you have at home. If 3 p.m. to 3 a.m. will work for you, you tell them you want to work those shifts and they will let you work those shifts. They will not impose a shift on you. Unlike back home where the schedule is fixed and there's nothing you can do just because the shift system are only 3. You're either going for morning, afternoon, or night. Here you can go for dawn. As I said, 3 a.m. is dawn. So you would build your own shifts to suit your life. Learn to speak up. If the shift is not working for you, quickly let them know so that they can change it for you. That is why in the preceptorship mode, you are tried on all the shifts and the one that works best for you, physically to your body. Night shift is not meant for everybody. Not everybody can stay awake at night. Yeah, just so you know, nursing in America, night shift, you are fully awake 12 hours. You cannot even blink, doze off, or do anything. You are literally on your shift. For some reason, the patient population do not sleep at night. Most of the patients are people who have worked night shifts as nurses and they've retired, and at night they stay awake. Most of them work security jobs. Most of them work in different states, different time zones. Did you know that there are so many time zones in America? As I'm sitting here, some people are 3 hours ahead of me. Some people are 2 hours behind me. Some people are 1 hour. Yes. So all these things, we will all not have the same sleep pattern based on our career, lifestyle, and jobs we used to do in the past. Some patients are in so much pain, they do not sleep at night at all. So they are going to call you. When their medication is due, you're going to give it to them at 1 a.m., 2 a.m. Some are on hourly medications. And the nurses are awake. You start all your blood draws at 4 a.m. so that by the time it's 6, you would have done all your morning blood draws. Some are fasting, obviously, so you have to be on your feet to get those done. You clean people that are incontinent and be able to hand them over in the morning. Your patient might need monitoring all night on telemetry, and you have to do all that. People might be coding. Somebody might need rapid response. Somebody might be deciding their oxygen level is going down. You need to be wide awake. So night shift is not meant for everybody. Some of us do night shift and we lose so much weight. I'm not a morning person either, so the 7 a.m. is too early for me. So you would have to test it out. So know that the shifts are flexible and nobody will impose on you. Take advantage of the preceptorship program. This is the time to do a lot of reading and research before you show up at work. If you find something new, you have to ask questions. Don't be afraid they're going to laugh at you. Ask questions, because when they leave you alone, 100% will be expected from you. And you have no excuse to explain, oh, I did not school here. Oh, I did not train here. Oh, I just got off orientation. No, no, no. You had a chance. You did not utilize it. I was reading like I was a full-time student again. I had notebooks. I was taking notes of everything. I was watching YouTube videos, how to use a CPAP machine, how to use a bladder scanner. I was reading and reading and reading. Then I have questions. When I go back, I ask my preceptor. A good preceptor will let you try a lot of hands-on, will let you get opportunities and go to other nurses when something comes up. Shout out to my preceptor once more. I know when there's a central line dressing and even it's not my patient, she goes like, anybody has anything for Priscilla to try on? Then the nurses say, oh, I have this. I have a chest tube. I have this dressing. I have this. Then I go and try them all. You should be willing to work. Laziness will not cut it. You cannot be lazy and be an American nurse, especially bedside nursing is intense, because you cannot hide under anybody's wings. They assign you patients, and then the patients are yours to care for in the entire shift that you are there for. If it's 12 hours, the patients are solely yours. Nobody's going to assist you. They are assigned to you. Your name is by them. If anything happens to them, who was the nurse is the first question they ask. You cannot hide under anybody's wings. So you need to ask questions during your training so that when you become that nurse, you'll be good. That is not to say that when you need help, you cannot go and call a fellow nurse, but you are solely responsible for that person. If you want them to help you turn a patient, you call somebody for assistance. There are nursing aides. Some floors have only one nurse aide on PCT or CNA or nurse assistant. And if they are busy, you have to find a colleague nurse to help you. Research, research, research. You have to read a lot. Ask questions. If you do not know something and the preceptor says, oh, can you go and turn the machine off, please? If you don't know where to turn it off, do not go. Say, please, I'm not sure I can do it. I need you to come with me and watch me do it. Because if something happens, it's going to be on you. Take full advantage of your preceptorship. Your preceptor can make or break you. And if it's not working for you, some people are not meant to be trainers, or you are not absorbing what they are teaching you, you have the right to go talk to the nurse manager or the person in charge that it's not working out and you prefer they try you with somebody else. I have seen very toxic relationship between preceptors and preceptee. It's just not working out. Speak up and let them change that person for you, because your license will be on the line when you make a mistake. They are now going to say, who trained her? Why did she not know this? They're going to say, who did this? Whose patient was it? They're not going to find who trained you. I am emphasizing on the preceptorship well. And if at the end of the duration, if they said 3 months to 12 weeks and you think you are not comfortable, please ask for extension. They would always check on you. Normally, weekly, every 2 weeks, you do a review of how the preceptorship is going, and they'll ask if you want to extend. There'll be goals you set for yourself. By the end of this week, I want to be able to get out an hour earlier than how I've been getting out, as in closing earlier. I want to be able to use the system to document better. The system tells you how late you are with your documentation. They actually award you percentages. EPIC, EPIC is one of the softwares we use. It tells you how late you have been on your documentations. If you did something at 7 a.m. and you are now documenting at 2 p.m. change of shift, the system will flag that. They'll send you a little pop-up message saying that you are slow on your documentation. Something done and not documented is not done. Something done and not documented on time is literally not done. Between that 7 to 2 o'clock, somebody looking in the chat did not say it, so it was not done. Meanwhile, you did it. So try and document promptly. It is best to say, if you are not familiar with gadgets, if you are not familiar with computer and you are still back home watching this, try and get a computer to practice with. Try and take a computer class. I remember I interviewed Becky, who spent 20 years as an immigrant nurse in UK. When she was coming, she did not know how to send a common email. Please familiarize yourself with sending emails, using your phones to send emails. When you're running late for work, you are not going to call your supervisor and say, I'm running late. You're going to send them emails. Even when you're going downstairs, it's an email. Oh, I'm going downstairs, you send it via email. They are not your friends to be calling them on the phone. They are not your friends to be texting them back and forth unless they text you before you reply. Every communication at the workplace is done by email for transparency and record-keeping sake. So learn how to send an email, the subject, the context, how to sign off and everything. Take a computer class and familiarize yourself with the computer. If not, you'll be like me, looking for Q, looking for W, looking for T. That alone can let you get out of work 3 hours later. This is the story of all of us immigrant nurses. We did not go to school with computer, so you can never be fast as compared to somebody who started playing at age 1 with computer. It is what it is, but you can still adapt, and with time you get better. Take advantage of all the benefits the workplace offers. You can organize or reach out to HR for a meeting so they tell you the benefits. They would give you a binder when you enroll the first day and tell you all about the facility and the benefits they offer. There are tuition packages, there are wellness packages, there are gyms you can go in the name of your facility, there are shops that you can buy scraps on discounts because you work at that facility, there are daycares that are attached to some facilities that your child can go on a discount just because you're an employee. There are tuition packages you can use to do your BSN or do your master's or specialize in any field. There are certification programs that you can do to get your credit scores to be able to renew some certifications. There are so many things that you can be a first-time homeowner and get some money to help you set up and buy your first home. There are so many things, health insurance, there's benefits, dental, vision, medical. There are so many benefits, but guess what? If you don't know, nobody's going to come and tell you, come and claim your benefits. You have to ask around. You have to do research. You have to speak with people who are already on the job for years. You have to speak with your HR person to be able to take advantage fully of all these benefits. Do not just come to work and go like some of us do. Take advantage of all these benefits. If you're into yoga, you might do that on a discount. I know ours is LA Fitness. Some have swimming lessons, some have swimming pools you can have access to with a discount. I buy scrubs, uniform, top and down on discounts because I show my badge. So take advantage fully. We immigrants, mostly we are afraid to face people, afraid to go to offices, afraid to make inquiries. Take advantage, make inquiry. Take full advantage of that. If you work 1 year, you have tuition benefit, they'll pay some of the fees or some of them are even fully paid. Take advantage of that. The next topic is career advancement. If you happen to be at a teaching hospital or university hospital, or even if it's just a hospital or facility that does not have a school or anything, they normally liaise with tertiary institutions, universities, colleges, community colleges, and things around that offer programs. And you can go and take such courses and the tuition will be covered. That is why most people are not traveling because they want to stay at one place, build that record or that loyalty. If they say stay 1 year, we'll pay for your nurse practitioner program, then you just want to first stay 1 year, go to the school, finish the school, and then you can move on. But if you're traveling, you don't get any of these benefits. You have to go buy them or pay for them on the other side. So being a travel nurse or agency nurse has its pros and cons as well. If you want to do your master's, if you want to do your degree, you want to do your PhD, it's better to remain at one facility, build that record, and then take advantage of the benefits they offer. Once again, be very careful at workplace. Nobody there is your friend. Back home, we are friends with our colleagues. We meet them in the neighborhood. We meet them at church. We meet them in the market. You talk, chit-chat. You go to their houses. They come to your house. Your kids play. It is not like that in the Western world. You are strictly there to get your work done and you leave. I've worked with people who I do not even know their last name or know their phone number because they are not your friends. You don't have any friendship or anything to discuss outside of work. Nobody is your friend. Be very careful of the culture difference. You might meet a coworker outside and they might not even recognize you. You might meet a coworker outside and they might not say anything to you. That is normal, very normal. Do not be offended. Be careful when you go to the workplace in making friends. Be careful what you say when it comes to talking to the patients. Certain things are not acceptable. As I said, if you see a diabetic eating some ice cream, it could be a sugar-free ice cream that you did not know existed. Be careful how you use your words. As I said, you cannot be holding a patient's hand, touching them, whatever. There are so many gender affiliations over here. If whatever the chart says is how you address the patient. If you are looking at a male in front of you and the chart is saying she, you have to refer to the patient as she. To be safe, you just have to go with the name. If you are seeing a female and the name is Paul, go in and address the patient as Paul. Ask them how you prefer me to address you as well. The same relates to your co-workers. You might have a co-worker who is transitioning and they want to be addressed in a certain way. It is not your job to go question them as to why do you have a name called Paul when you are a female? No, leave it alone. Be sensitive to every gender. Be sensitive to every race. Be sensitive to every culture. Just come there, do your work, and leave. There are so many words we use back home that you cannot be using here. You have to open your eyes and ears to be able to learn that language and change your language as such. I'm coming. You cannot be saying I'm coming. I'll be right there. You need to learn the language. You need to learn the culture. You need to be very careful. We come from a different place. Our English is mixed up being American and British. There are some words you have to leave alone and relearn. Learn and relearn to adapt into your new environment. Most of us spend so much money before we finally relocate. You take loans to buy plane tickets. You took money from family, friends to be able to do the paperwork, to be able to travel. So as soon as you get here, your goal is to work, make money, and then pay back your loan or make money and bring your family to join you. In the quest of money search, you need to prioritize your health and comfort. Most of us have minds of we want to build a house back home, we want to do this for our parents, we want to do this for our siblings. Your salary is just one, and you cannot do it all. You need to really have a financial plan and discussion. You need to be comfortable wherever you are first before you think about those who are back home. For instance, people are building mansions, 10 bedrooms at home, and you are renting a studio, a small room here, or you are having a shared apartment, and this is where you live. The 10 bedroom is going to be locked up or rented to somebody who will live there comfortably for peanuts. That is not to say don't do projects back home, but there's time for everything. The priority is to come in, settle down, work, save some money, get a home, get a place that will be comfortable for you where you are before you begin doing things back home. You have to work to be able to let your spouse and children join you. You have to get your priorities right. You have to plan and save towards it. Bring in a spouse. The spouse might be doing a very good job, but because of relocation, they would have to leave their job and come. What plans do you have for them? Are they going to find a job as well? That is the question. People ask me, will my husband find a job? Will my wife find a job? She's not a nurse. She's not a professional. So whilst in the quest of you trying to achieve your career goals and dreams, consider your partner's career goals and dreams as well. The state you are going to, the city you are going to, what do they have available? Will they also find a job? Because you do not want to be the one going to your nursing job and have a man in the house 3-4 months, no job. That would drive him nuts, especially if it's somebody who has been very independent and working all these years before you moved him. You're going to begin to have fights in your home, marital issues, because you are now the breadwinner, quote unquote, and he is down home depending on you. It is very normal in the first few months to stay at home, but make sure the country of choice, the city you are going to, your partner will find something to do. For the woman, if the man is the career person who has relocated and the woman is coming and maybe you have younger kids, for a meantime, you can stay home and be nursing the kids until you get into the school system. Relocating also means that you have to look in the school calendar because the school calendars vary. If you come in a time when it's December and it's Christmas break, obviously the kids cannot go to school. So even if you find a job, you cannot go to that job because there's nowhere to keep the children. So you have to calculate. Planning in all spheres of life, financial planning, timing, and everything. In the meantime, when the spouse is coming, the person should also come with some money to be able to stay home and do little things and contribute to the home, or also take a walk outside and go to buy a snack or something for themselves and have some freedom and also breathe some fresh air. Relocating is very hard and stressful and expensive. Buying tickets, waiting for visa, interview dates. I know so many of you have passed and are just waiting for interview dates. You cannot wait to leave your job or leave your country and relocate and start working and start making money and clearing your debts. You have spent so much money investing in finding that job. You're always going to the internet cafe, buying data, printing, doing interviews and all that. It will be worth it at the end, but make sure that you are comfortable where you live and make sure the family is comfortable. And do not forget those who have invested in you and those who believed in you and those who encouraged you, those who urged you on, those who helped you. Do not forget them when you relocate. You would always need something back home, trust me. You would always need somebody to do an errand for you back home. You would always need a family member or a friend to do something for you. And you have to have that contact established. If not, they'll feel like you are using them. Be very careful on the people you surround yourself with when you do relocate. Some people want expensive cities. They want the glam life, the noise. Some of us also want the serene, quiet, green, suburban life. The choice all depends on you. If you have a younger family, you want to raise a kid in the yard, have a playground for them, stuff like that, the suburbs are good for you. Moving to the suburb means that the cost of living will be low and also the jobs will not pay you well. Moving to a place like New York City or Los Angeles, California, places like that, the jobs will pay you well, but the cost of living is outrageous. Your rent alone can be $5,000 a month. But that $5,000 can get you a whole 8-bedroom apartment somewhere in the suburbs. It all depends on your personal goal, what you want to achieve in life. If you are here and your partner is into the fashion world, obviously you want them to live in the Hollywood area or the New York City and pursue their career in their fashion life and lifestyle, glam, whatever they want to do, TV presentation and all that. So you two have to come to a consensus and decide on what you want to do as a family. It is very tough when you are all doing that, the dreams. Somebody's dream is this and the other person's dream is that. It is very confusing and sometimes can bring conflict. Most of you can relate to what I'm saying. One thing I would like to say, avoid toxic environment. If you do launch that dream job or do get that job that brings you to the country that you are relocating to, and the environment is not working for you, the job is not what you anticipated, the co-workers are toxic, you are not being received well, it's just not working for your mental health, you come home depressed, stressed out, crying and all that, do you know it is normal to get out? Do you know it is normal to speak up and tell them you cannot do this anymore? You can always seek a transfer to a different unit, a different floor, a different office, a different city, a different branch. Most of us are used to staying at one place because we don't have many options back where we come from. So you stay at the job 10, 20 years and it's just stressful. Luckily, most of these jobs have branches. One hospital can have different hospitals attached to it. You can go from inpatient to outpatient in the same company. You can go from inpatient to outpatient or nursing home in the same company. But how will you know if you don't research? How will you know if you don't speak to somebody who is in that field? How will you know if you don't ask around? Always mingle with the right people. If the job is getting toxic, seek transfer. If you say, oh, I'm on a contract with the company for 3 years, so I cannot change my job, you can change your floor. You can go to a different floor. If you're an emergency surgeon and you're having issues, you can try dialysis or oncology. You can go to a different branch entirely. If the place they brought you is so far from you or something for some reason, there are other branches that the same company has and they can move you around. The fact that you're under contract does not mean that for the 2-3 years you should be suffocating on a job just because you're under contract. Change your units, change your floor, change your ward. It's doable. I am speaking out of experience. I have changed when I needed to. Also, whilst you get off orientation, you will still not be there yet. You need a lot of years to be able to get the experience and the confidence you need. Feel free to ask questions whilst you are still on your own when they assign you patients. If something is not doable, speak up. No, this will not work for me. Please, I cannot do it. Sorry, it will inconvenience me. We should learn to say no when the time is right, not only at the workplace, but also in our lives, friendships, family. We should learn to say no. Most of you travel and then become the breadwinner for the family. Everybody is calling you. Your uncle's son has swallowed a hammer. This one has been hit on the roadside by a goat. This one is building this. This one is school fees. This one is medicine. You need to prioritize. Do not send all your investments back home, because back here is very lonely and boring, and you are all alone. If you lose your job today, do you have any savings to cater for your bills whilst you are here? It is easy to become homeless because you are paying your mortgage monthly or you are paying your rent monthly. You are paying for your insurance of your car or your health. Everything is monthly. So the day that you do not work, that ends it. Take it from me. As I said, I got my RN license and I was home for 6 months and I did not work. That doesn't mean that my car will not be paid. The car company will not take the story of, sorry, I've not been working, so I cannot pay your money. The deductions will be coming out of your account. You should always have at least 6 months saving in advance for contingencies or emergencies. Because if your car payment is like $600 a month, and they're going to take it for about 6 months, that alone is how much? $3,600, $3,600. Do you have that saved in case you cannot go to work today? We have not talked about your rent or your mortgage, your health insurance, your phone bill, and many more. Especially in winter when you have to pay electric because you need the heat to keep warm. Relocating is not easy. Transitioning is not easy. It is doable. Most of us have done it. One thing is that you're never going to be fully there because you did not come from the country that you have relocated to. The weather is different. The people are different. The food is different. The culture is different. Even if you stay there for 40 years, you will still not adapt fully. So far as you are not born here and did not train here. But you can always strive to be the best. You can always strive to be the best. You can always make your life comfortable. Be comfortable, aspire higher, do career progression, take advantage of all the services around. Do not be afraid of life after NCLEX. Eager to enter USA. You hear us saying it's not easy, but keep your head high, stay motivated, surround yourself with like-minded people. My name is Priscilla Kuma. Hope this has been helpful, and I'll come to you next time with another video. Take care, signing out, and don't forget to share this video. Thank you, and bye-bye.